All right, thank you, Derek. In Health Watch this morning, it's a form of diabetes only found through genetic testing.
Monogenetic diabetes happens when there's a mutation in a single gene, and treatment does not always require insulin shots.
Joining us now, Dr. Lou Philipson, who's the medical director at the University of Chicago Kovler Diabetes Center, and Michael Eizenga, who was diagnosed with monogenetic diabetes at just 20 years old.
Michael, we'll start with you because I'm guessing with type 1 diabetes, you went through a series of shots for a long time, but then now you're taking a pill?
Yeah, for 11 years I took daily insulin shots and pricked my fingers, and now I take a pill at every meal.
Wow, and it was that easy.
It was that easy.
It works the same.
Yep.
So this genetic testing was really life-changing for you.
It was unbelievable. My quality of life has improved dramatically.
Tell us about the testing.
So it's important to understand that this is a rare form of diabetes.
Right.
Most people know about Angelina Jolie and having a gene cause cancer. So in this case, there's about 20 different genes that can cause very unusual and mostly rare forms of diabetes. When we can make a diagnosis, at least some of those people, like Mike, can change from shots to pills, but it also has implications for the whole family.
How so?
Because it is genetic. So just like having blue eyes or brown eyes, usually we find it in multiple generations. Now, not in everyone's case is it in multiple generations, but doctors often don't have time to look for it. So because of that, we're having a symposium this week, ending with a medical symposium on Saturday, bringing in scientists from all over the world here to Chicago to talk about these rare forms of diabetes.
There are a lot of people that will watch this at home and wonder if they're able to get this testing done, but you're saying this is for one specific kind of type of diabetes.
Well, as I say, it's about 2% of all diabetes, but that's a lot of folks. If there are about 25 million people in the United States with diabetes, it could be 500,000 people who have this. Most of them have never been diagnosed, even though we've known about it since the 90s. So genetic testing has to be thought about. It is expensive, and so your doctors have to really work through whether you're a candidate or not, and that's where we're helping out with that.
Well, Michael and Dr. Philipson, we appreciate you guys being with us early this morning. Lots of information to learn here. And this reminder, CBS 2 is a proud sponsor of the American Diabetes Association and the effort to stop that disease. You'll find more information on our website right now, cbschicago.com/diabetes.